News Extra Time on KNEB, brought to you today by Gehring Civic Center. And here is Kevin Mooney.
Thank you, Dennis. Good morning, everyone. I have a very interesting gentleman with us today, Dr. Brad Coots. He's the new reconstructive and plastic surgeon over at Regional West Medical Center. Just got here, as a matter of fact, just a month ago, and just started his practice on January 21st. So he is a newcomer to the area and part of the recruitment that the hospital is doing to bring in more doctors and more specialists. And first of all, welcome.
Thank you.
Let's go over your bio. Your bio is pretty amazing. When we were talking out there, I even told Joanne I couldn't write it all down, so she's going to have to send me a press release. But kind of explain, you're from the Illinois area and all the wonderful places you've been to school and so forth, and even the missions you're doing.
Yeah, thanks for having me this morning. So most recently I was in Iowa. I was at the University of Iowa on staff there, and one of my duties was to co-direct the Cleft Lip and Palate Clinic. But I grew up in Illinois near Peoria, went to school at Indiana University and Bradley University, where I received my degree, and then went on to medical school at Southern Illinois University in Springfield, trained in Michigan at Michigan State for my residency, and then did a hand and microsurgery fellowship in California. I was then in private practice for a few years, and then made the decision to go back and do a pediatric cleft and cranial facial fellowship due to my enjoyment of taking care of kids. And that took me to Memphis, Tennessee, and Paris, France. And then after that, I worked as a couple years in Iowa on staff taking care of kids, and my wife and I just wanted to go back into private practice, kind of have a little bit more of a steady pace of life, spend some time with my kids. So that brought us out here to Scotts Bluff.
All right, fantastic bio. Talk about what you specialize in. Not just plastic surgery, but reconstructive surgery is kind of why you're here, and how you kind of fit in with some of the things that are going on at Regional West.
Yeah, well, Regional West, I was really impressed when I visited here this past summer with just the array of services and the quality of physicians that are on staff. It was one of the reasons that I came here. They've got really an array of services, especially in the surgical subspecialties. So my specialty really allows me to interact with a lot of other specialists, such as oncologic surgeons in the realm of breast cancer, orthopedic surgeons with people that have had bad fractures and limb injuries. Hand surgery is one of the things that I do. I've done a fair amount of replantation in my career. And the trauma that Regional West specializes in, the craniofacial and the extremity trauma, is something that I'm looking forward to helping out the area with.
All right. And you just started on January 21st. Are you seeing, obviously you started seeing some patients, seeing a lot of need for what you specialize in?
Yeah, it's been surprising. We've had some clinics last week and starting to see some patients, and patients seem excited to have someone here in the community that offers the services that I do. They don't have to travel out of the region. I've done a couple of outreach visits to Gordon and Torrington, and tomorrow we're going to Sydney. So there's likelihood that I'll do some outreach like a lot of the other Regional West physicians do, 1 to 4 times a month to some of these areas, just to offer some services to those folks in some of the areas that, again, don't have a regional medical center right in their backyard. So it's exciting.
All right. You've also done some mission trips to a number of places.
Yeah, it's, again, taking care of kids is something I enjoy doing. It was one of the things that took me into academic practice at the University of Iowa, and I'm looking forward to taking care of kids here in Scotts Bluff, but I really enjoy going on mission trips to the Third World. I've traveled with Operation Smile. I've traveled with Rotoplast, which is a Rotarian sponsored group out of San Francisco. It's taken me to Africa, to India, Honduras, Dominican Republic, and later this month I'm gonna go to Bangladesh. So we usually go for 1 to 2 weeks, and usually between 3 surgeons. We'll treat anywhere from 100 to 150 kids, and it's really gratifying. So I enjoy that.
Once again, our guest today is Dr. Brad Coots. He's the new reconstructive and plastic surgeon over at Regional West Medical Center. Tell us about your family. Your wife is a veterinarian.
Yeah, my wife Carmen is a veterinarian. She is a graduate of the University of Illinois, and she's been in practice now for, I think, 15, 16 years. And she specializes in small animal medicine. She's taken a job with Paul Ragone out at the Animal Health Clinic or Health Center. And I've got 2 kids, a second grader and a pre-kindergartner, and they're looking forward to getting into some of the activities here in Scottsbluff. They've already discovered the Y, and my son's going to start taking some drum lessons. So yeah, we're excited about getting involved in the community, and it sounds like there's a lot of things for the kids to do here.
That's good. That's good. That's great. Yeah, our YMCA is really a wonderful Y for a community this size. So yeah, you're ready to go. Well, we're really glad to have you here, especially with, well, look at all the things that you've done. And let me just ask you, when you were saying you wanted to get into private practice and back into private practice and all the things that you've done, when you came to Scottsbluff, what attracted you to this area?
Well, the medical center was, the primary attraction, and just the administration and a lot of the doctors that I met there. I was impressed with Dr. Sorensen and Sal Aziz, and just the administrative staff there. They sounds like they've got a good vision for the future, and it's a physician-run organization, and they've got their eye on the future. I think they provide a great service to this region. It's I don't want to say it's unusual, but some of the areas that I've lived in, towns of this size, it's impressive that they have a medical center that's as comprehensive as Regional West, and it was attractive to me.
All right. Well, we're glad to have you here. We really are.
Thank you.
Somebody of your caliber into the community, and if anybody is interested, they can give you a call. You've got you listed. What do they do? Just give the hospital a call here. What's the phone number for your office? Why don't they just give the hospital a call and just ask for you? Right?
Yeah, online. We also have a website. They can access my Regional West information on the Regional West website. Also, they can go to the web page of the American Society of Plastic Surgeons, where I have a web page, and certainly they're free to call. Be happy to help them out any way we can.
All right, 635-3711 is the number at the hospital, and you can find your way to Dr. Coots. All right, very good.
Thanks, Kevin.
Thank you, and welcome to the community.
Thank you.